Today, Dr. Bill Vandergrift will be educating us all on the functional technologies that are available in the new supplement Gastrofix. Dr. Bill is a PhD equine nutritionist that brings nearly 40 years of experience in formulating equine feeds and supplements. Not to mention, he is a past university professor and he has consulted for horses all across the world. And not just any horses, his clients include Olympic medalists, world champion show horses, and triple crown winning racehorses. It's been an absolute pleasure to work with Dr. Bill in the development of this new foregut supplement, and the two of us believe that it's going to be a game changer for many horses out there. I'm super excited for Dr. Bill to take the stage today and give his view on Gastrofix and how it could benefit your horse. Welcome, Dr. Bill.
Okay. Well, thank you very much, Dr. Nichols, for that kind introduction. And like you, I am also very excited about this particular product. And I do want everybody listening in to appreciate the fact that you and I, work together to create this product and formula. And if you will allow me, I'd kind of like to say it's exceptionally exciting for me because I tend to believe I kind of bring what I refer to as the old school into this. And Dr. Nichols definitely brings in what I refer to as the new school into this in equine nutrition in this product. And I think between the two of us, combining our skill sets, that we've really got something here that's really going to be a benefit to an awful lot of horses. So with that, what is Gastrofix? In simple terms, Gastrofix is a pelleted product, and I will say we intentionally made it a pelleted product for easy feeding as well as palatability. As I'll talk about later on, this product can actually be fed all by itself. There are very few gastric products that you can just put in front of a horse with nothing else and have the horse consume it. But this is one of them. And that was one of our goals when we set out to develop this product. So it is a pelleted supplement, and it's recommended to support, normal pH of the horse's stomach. So it is a gastric buffer, but it is so much more than that. It brings also to the table the ability to soothe the gastric lining, soothe the lining of the duodenum, the first part of the small intestine, and also support the health of all of the epithelial tissue in the stomach as well as the small intestine. So while its emphasis is on the foregut, being the stomach and the upper part of the small intestine, we've also incorporated some benefits that are going to help out the entire digestive tract. But again, emphasize the fact that it is primarily a foregut product. So in simple terms, how can Gastrofix help your horse? The primary function of Gastrofix is to either prevent or at least reduce the severity of gastric ulcers in horses. And I think most of us are well aware there have been, quite a few webinars and articles and things posted on YouTube and whatnot on the topic of gastric ulcers in horses. In fact, I've participated in several of other webinars personally. So I think there's a pretty good knowledge base out there amongst horse people about gastric ulcers. But I do think it bears repeating here that it's estimated that 1 in 3 horses, especially athletic horses, 1 in 3 are going to suffer from gastric ulceration. So to kind of put that in perspective, if you walk into a stable and you own a horse in that stable, and you're looking at the horses on either side, one of those 3 horses is going to have gastric ulcers. If it's not the one on the left or it's not the one on the right, chances are it's yours. So just gives you an idea of how prevalent gastric ulcers are in horses. So, but another important point is that the more we learn about gastric ulceration, and I'll get into the anatomy a little bit to understand this or clarify this further. But a horse can have ulcers in what's referred to as the non-glandular region of the stomach. He can also have ulcers in the glandular region or down in the pyloric region, which is that part of the stomach just before digesta is going to enter the small intestine. Or you can have ulceration in the small intestine itself. The upper part of the small intestine, which is attached to the stomach, is referred to the duodenum. So obviously then we call those duodenal ulcers. So you've got 3 different locations that a horse can develop gastric ulcers. And in some horses, they will have ulceration in 2 or even all 3 of those areas. And in which case you're going to have a very unhappy horse. And in fact, that's why I've got the pictures on here about going from this. You can tell the horse in the orange shade got his head down, his ears back. You can just look at his eyes and his lips, and he's just not having a very good hair day. And that is not uncommon at all for horses that have severe ulcers. So by preventing ulcers, treating ulcers, managing horses in a way that reduces ulcers, we can shift that horse from being that unhappy horse on the left to a horse that's alert, bright-eyed, has his ears forward, and essentially a happy horse. And Gastrofix can be a very important component in your ability to support your horse's well-being in that regard. So as promised, let's take a look at kind of a caricature diagram of the horse. I think sometimes it's easier to present this stuff in a diagram rather than looking at a real photo, although I do have a real photo there on the right. So in the horse's stomach, the non-glandular region, sometimes referred to as a squamous epithelium component of the stomach. So you may have heard of, squamous cell ulceration. What they're referring to there is ulcers in this non-glandular area of the stomach, which, as you'll see, is the upper part of the stomach. And that's important to note that it is the upper part of the stomach. This is the area, here we would have the esophagus attached right here. So when your horse swallows, the food obviously comes down the esophagus and enters the stomach first in this non-glandular region. The lower part of the stomach is referred to as the glandular section. And then here you would have your pylorus, which is the juncture between the stomach and the small intestine. So this represents the duodenum, or the very upper part of the small intestine. The boundary between the non-glandular and the glandular region of the stomach is referred to as the margo plicatus. And it's actually, as you can see in this photograph of a horse's stomach, it is very distinct. It's very easy to see the difference between the non-glandular region and the glandular region of the stomach. So with that understanding of how the stomach's put together, let's take a little bit closer look at some things here. Let's first look at non-glandular equine gastric ulcers. So we grade those from 0 to 3. And over here on the left, you can see we have a healthy, non-ulcerated stomach. And again, you can clearly see the separation between the non-glandular, or the squamous area of the stomach, to the glandular region. Now, for non-glandular ulcers, these ulcers are going to occur above the margo plicatus line, or in other words, in the non-glandular region. So a grade 1, you're going to have mild ulcerations with only small lesions. That is still going to affect your horse's temperament, his appetite. He may not be severe, but you are going to begin to notice that your horse isn't quite as happy as he or she used to be without any ulceration. As this ulceration progresses, we get into moderate ulcers where the lesions become larger. And then from there, they not only get larger, notice they get deeper. So when you get into a grade 3 ulcer, you not only have a large area, but now that ulceration goes deep into the lining of the stomach. I kind of would use an analogy for you here. I'm sure everybody has had a little bit of a cut on your finger. Maybe you put a Band-Aid on it and you're good to go. It's still bothersome. It still hurts, but a simple cut I would kind of refer to as being a moderate ulceration, in that case of your finger. And I'm sure also most of us have had the unfortunate episode of having a sliver go deep into our finger. And anytime you happen to touch where that sliver is, whether it's a piece of wood, or even I've even had pieces of hay go into my finger and go in deeply. Boy, that hurts. That hurts a lot. And so you can kind of use that as a parallel between how these ulcers or different grades of ulcers are going to affect your horse. They're all going to affect your horse, just like any cut on your finger is uncomfortable. But the deeper that cut goes, or the deeper a sliver goes into your finger, the more painful it becomes. So Gastrofix can work very well against these non-glandular ulcers. And you can see in this diagram of non-glandular ulcers, this would be a grade 3. These are very large ulcerations that also go quite deeply. So this horse would actually be in a lot of pain. I can assure you of that. So with Gastrofix, one of the things we do is we buffer stomach acid. By buffering the stomach acid, that reduces the acid's ability then to damage that non-glandular region or the squamous cells in the non-glandular region of the stomach. But we're also going to supply some ingredients that are going to support a protective barrier. There is a mucus barrier that essentially covers the lining of the stomach, which protects it from the acid in the stomach. And when that protective mucus barrier decreases or disappears altogether, your horse is more susceptible to ulceration. So we have some ingredients in Gastrofix that are actually going to support the production and the maintenance of that mucus barrier. We're also going to facilitate tissue repair. So when we do get ulcers, as we see in this picture here, we've got some nutrients, some ingredients that are going to help those ulcers heal that much quicker. And also it's noted, or should be noted, that Gastrofix can be used, and actually we would recommend it be used with omeprazole or Gastrogard if you are in fact treating active ulceration. And that's another important point. And a webinar I did a little while ago, I actually did it with two veterinarians, one of which was Dr. Frank Andrews down at Louisiana State Vet School. I consider Dr. Andrews to be one of the, if not the main guru, so to speak, when it comes to gastric ulcers. And all the veterinarians participating in that webinar were in agreement that if you actually have ulceration, as we do in this picture, you really need to treat the horse with omeprazole or Gastrogard. In other words, you need to treat the horse medically. We really don't have any non-medical treatment for ulcers that's been considered as nearly as effective as the medical options that are available to us. So if you do in fact have a horse with ulceration, work with an attending veterinarian, work with their medical protocol that they put together for your horse, and then use Gastrofix as a way to actually help the efficacy of that medical protocol, but also help prevent those ulcers from reoccurring. Now, with glandular ulcers, and if you remember now, the glandular ulcers are going to occur in the lower part of the stomach and towards the pylorus, which is where the stomach empties into the small intestine. So ulcers in the glandular part of the stomach are less responsive to treatment than ulcers in the non-glandular region. So if I'm presented with a horse that's got ulcers in the non-glandular area, usually by maybe changing management, treating with GastroGuard, working with my vet to get those ulcers cleared up, we normally have a pretty high success rate of healing those ulcers. When we get ulceration in the glandular part of the stomach or in the duodenum, it usually takes longer. We might have to use a bit more aggressive treatment. We've got to use some medicines other than omeprazole. We might add misoprostol. We might add sulcrafate. We might add hyaluronic acid. Depending upon how the horse responds, your veterinarian, may modify the medical protocol. But I mentioned that to underscore the fact that ulcers in the glandular area are difficult to treat. And that is why trying to prevent ulcers in the glandular section of the stomach can really go a long way to keeping your horse healthy rather than trying to treat them. Ulcers in the duodenum kind of fit in the same category. And this is a picture of equine duodenal ulcers. And I don't mind giving credit. You can see that this was a picture shared by Dr. Saka. But you can clearly see the ulceration. Now, this is the upper part of the small intestine. Okay, so we're no longer in the stomach, but we're just beyond the stomach into the duodenum, into the very upper part of the small intestine. And you can clearly see the ulceration in the intestinal lining there. Now, duodenal ulcers are very difficult to diagnose because we normally diagnose gastric ulcers via endoscope. So we can get an endoscope into the stomach, but we cannot always get it all the way through the stomach, all the way through the pylorus and into the duodenum or into the upper part of the small intestine. Sometimes it's just not going to happen on any particular day. Keep in mind that when you've got duodenal ulcers, you may or may not also have glandular ulcers in the pyloric region. And when you've got ulceration of the pyloric region of the stomach, it becomes inflamed, which then makes it even more difficult to pass an endoscope through the stomach and get it into the small intestine. That said, though, remember I said, ulcers can occur in the non-glandular part of the stomach, that they can occur in the glandular part of the stomach. They can also occur in the duodenum. You can have a horse that has ulceration in the duodenum and no ulcers in the stomach. So I know of veterinarians that specialize in internal medicine that if a horse presents, in other words, his behavior and so forth, he walks and talks like he's got gastric ulcers, but they do an endoscopic exam and there's no ulceration in the stomach, they're going to then assume, and if they can't get the endoscope into the duodenum, they're going to assume that they're dealing with duodenal ulcers. And they're usually proven right, because then after they treat accordingly, the horse improves. So that would be indicative that the horse did in fact have duodenal ulcers. But similar to glandular ulcers, ulcers in the duodenum can be very difficult to treat. Sometimes they just don't respond as well as non-glandular ulcers in the stomach. The treatment protocol for duodenal ulcers is many times exactly the same as it would be for dealing with a horse that had glandular ulcers. But keep in mind, if you've got a horse that's got off behavior and you can't explain it, he might have periodic diarrhea and you can't figure out why. Duodenal ulcers could be the primary cause of that behavior and those digestive dysfunctions. Like glandular ulcers, it's a lot easier to prevent duodenal ulcers than it is to treat them. But in relation to duodenal ulcers in particular, I also want to bring your attention to the role that the liver and the pancreas can have on ulceration in this part of the digestive tract. We rarely hear people talking about liver function, pancreatic function in relation to ulcers, but both play a major role in maintaining normal digestion and preventing duodenal ulcers. And liver dysfunction can actually cause significant temperament changes in the horse. So when we have some of those unexplained behavioral changes in horses and the stomach scopes clean and we just can't see, and he does not have diarrhea, and you're saying, I don't understand what's going on with him. Sometimes liver dysfunction can be beginning. It can be part of the cause for that. I personally this was several years ago, had a yearling thoroughbred filly that we foaled and raised. And what was interesting about this particular filly is she really was a sweetheart. She was very easy to get along with. She was willing to learn, was willing to please. And within a short period of time, she turned into a little hellion, just to be blunt. In fact, I had two very capable people working with us on the farm, and they got to the point where they said, I don't want to handle this horse. You know, she's getting dangerous. And she would strike out at you, very uncharacteristic. And so obviously we're thinking, you know, ulcers, but nothing going on there. Thanks to a particular veterinarian, Dr. Sprayberry, who used to be at Haggard's in Lexington, Kentucky. I think she's now at University of California at Davis, internal medicine vet, great vet, great person. She suspected liver dysfunction. But here's the key on liver dysfunction, and I'm getting a little bit ahead of myself, but that's okay. With liver dysfunction, changes can occur in the horse before you can actually measure it in the blood. That's the point I want to make. And I'll give credit to Dr. Sprayberry explaining it this way. When you have liver dysfunction, your horse is going to have a chronic headache, essentially. And that chronic headache then will obviously change their temperament. So liver dysfunction is something that we're actually starting to see more and more of. And I really think the reason for that is we're getting better diagnostics on liver function. But again, I got a little bit ahead of myself. Let's first look at the pancreas. And there's a couple of things I want to point out to you here. One of the major functions of the pancreas is to secrete digestive enzymes into the small intestine that are going to break apart, digest carbohydrates, proteins, and even fats. But primarily, you know, amylase, proteases, so enzymes to break down the carbs and the proteins. But also, it secretes buffers to increase the pH of the digestive coming from the stomach. So in the stomach, you've got a very low pH, a very acidic pH. In the stomach, you've got close to a neutral pH. So it's part of the pancreas's function to secrete buffers into the small intestine, so it very quickly buffers that acid coming from the stomach so it doesn't damage the small intestine, especially further down the small intestine into the duodenum and into the ileum. But pancreatic dysfunction is rarely confirmed in a horse. And when it is, it's usually confirmed as something that's secondary to liver dysfunction. So liver dysfunction and pancreatic function work very close together. Now in the diagram of the pancreas, so this is the duodenum. You can see the pancreatic duct that comes through the pancreas and then empties into the small intestine. Notice something else. common bile duct. Now, where does the bile duct come from? The bile duct comes from the liver. So notice that this green bile duct from the liver comes through and joins with the pancreatic duct. So you have a common entry from the liver and the pancreas into the upper part of the small intestine. So you see how important it is for the pancreas and the liver to work together. Let's take a closer look at the liver. One of the major functions of the liver is to secrete bile acids and salts, which help break up fat. Remember, fat and water don't mix. So when you add fat to a horse's diet, it's got to be emulsified. The bile acids and the lecithin from the pancreas and the liver are what allows that fat to be emulsified so that the lipase and the other digestive enzymes can break it apart and it can then be absorbed into the horse's body. But another major function of those bile acids and salts, you guessed it, is to buffer small intestine pH. So not only does the pancreas have a buffering function, but the liver itself has a buffering function. I think most of us are aware that the horse is a little bit unique in that it does not have a gallbladder. It does not have a means to store those bile acids and salts. This is a diagram essentially of a human liver and pancreas, but it's all the same in the horse with the exception that the horse does not have a gallbladder. That's why I've got it circled with an X through it. So the horse's liver is only going to secrete those bile acids and salts and buffers when stimulated by active proteins, carbohydrates, and fats. In other words, food or digesta that enters that duodenum. Now, we've all heard that horses on an empty stomach or horses that have an empty stomach for a prolonged period of time are more susceptible to ulcers, and that's true. They continue to secrete acid. That acid continues to leave the stomach and get into the small intestine. But in the horse is not going to release those buffering agents unless there's food present, okay, in that duodenum. So you can see that an empty stomach not only predisposes the horse to ulceration of the non-glandular region, the glandular region, but then also the duodenum, because you're not triggering the liver and the pancreas to secrete those buffers. Also keep in mind, the liver is the primary site for glucose regulation in the body, and it's also responsible for detoxifying poisons that are in the body. Now, I'm using poisons here in a very broad sense. We can consider non-steroidal anti-inflammatory drugs a poison from the standpoint that it's the liver then that metabolizes those and excretes them from the body. Now, why is liver dysfunction in the horse not diagnosed very often? The major reason is that at least 70% of liver tissue has to be affected before you're going to get a measurable change in the blood parameters that we normally look at when we're evaluating liver function. To accurately determine that, yes, we do in fact have liver dysfunction, a liver biopsy is often performed. And that is an invasive procedure. But if you suspect liver dysfunction, your veterinarian may opt for a liver biopsy in addition to the normal blood work. In fact, the yearling filly that I referred to that we owned personally, we did do a liver biopsy on her because her blood parameters were not that far out of normal. But her liver biopsy did in fact confirm that she had liver dysfunction. Now, why she developed it, we will never know. But she did in fact have it, and we were able to correct it. We did a dietary change and a little, a couple of management changes, and gave her a couple of months, and her liver regenerated, and she went along and had a very productive athletic career after that. But Gastrofix is really one of the few products that is also going to support normal liver function in addition to uh, gastric function and small intestinal function. The licorice that is in Gastrofix is there because it is known to support normal, healthy liver tissue. Also, chromium is a mineral which is primarily responsible, or one of the things it's responsible for is insulin function. So there's your pancreatic function, as well as glucose metabolism. So it interacts with the liver, keeps the liver functioning normally, keeps the liver healthy. And so if you're wondering what chromium and licorice are doing in a product that's primarily designed to reduce gastric ulcers, that's why it's there. We're improving liver and pancreatic function and also improving duodenal health at the same time. So how do we prevent equine gastric ulcers? Number one, reduce the sources of stress in your horse's life as much as possible. Emphasis on the word or words as much as possible. You cannot have a zero stress environment, especially if you've got an athletic horse. But think about, put yourself in your horse's shoes, figuratively and literally. Think about all the things that your horse has to deal with on a day-to-day basis that could possibly increase the stress level for that particular horse. Just like people, something might stress one person and another person takes it in stride. Horses are no different. So equine interactions, human interactions, transportation is a very large cause of stress in horses. Even horses that are trailered a lot. Do not assume that transportation does not affect those horses, because it will. Training, whether you're teaching them something new or you're simply keeping them fit. Training adds stress, which is going to increase a predisposition to ulcers. The life of a show horse brings stress with it. Changes in environment, changes in water, the transportation, it all comes together. Heat in an oven by itself is stressful for a horse. It's also stressful for their digestive tract. So anytime that, well, here we are in winter when we're doing this webinar, but in the middle of summer, just the stress of heat and exercising in that heat is often enough stress to trigger ulceration in these horses. Dietary changes, dietary management. Dietary management fits right in with the very next line. Do not let your horse go more than 6 hours without eating. You definitely want to keep food in your horse's stomach on a regular basis. It may go empty in 4 hours, it may not, but you don't want it to be empty very long if it does go, in fact, go empty. So we say, don't let your horse go more than 6 hours without having some hay or something to eat in front of them. Don't exercise or transport your horse on an empty stomach. I always like to have hay in front of my horses all the time anyway. But if you say you go out to the barn, first thing in the morning and you're ready to, exercise your horse for whatever reason, and they haven't had you notice, oh, they're out of feed, put a little bit of Gastrofix in front of them before you tack them up and exercise them. Or, make sure, throw some hay to them. Let them eat a little bit of hay. Let them get something in that stomach. So give that stomach something to work on prior to exercising. Do not feed large amounts of high starch feeds, like, for example, straight oats or a heavy grain sweet feed. Research has shown that feeding a large amount of a high starch feed increases the predisposition for gastric ulcers. And then, of course, include Gastrofix into the feeding program as a preventative. because, as I mentioned earlier, there is no way you're going to reduce the stress in your horse's life all the way down to zero. You can do all of these things. In other words, keep hay in front of your horse all the time. Don't exercise or transport on an empty stomach. You're not using a lot of high starch feeds. You're managing your horse in a way to reduce stress as much as possible. You're exercising early in the morning in the summer times to avoid the heat of the day. In other words, you're doing everything correctly. But an athletic horse is still going to be predisposed to gastric ulcers. So as a way to help prevent those, Gastrofix is a great product to incorporate into your program to help prevent those. So your take-home messages that are unique to Gastrofix. Don't forget, it's one of the only products that's going to address all three types of equine gastric ulcers: the squamous or non-glandular ulcers, the glandular ulcers, and the duodenal ulcers. We use multiple buffers that have complementing modes of action to stabilize the pH throughout the entire stomach. Now notice these are buffers. We are not stopping. These are not proton pump inhibitors. We are not stopping acid production, okay? That's what omeprazole or Gastrogard does. The horse is still going to produce acid the way he always does, he or she always does. We're simply going to make sure that the pH in that stomach doesn't fall too low where it can then start eating away at the lining of the stomach. Gastrofix is going to support normal function of the liver, and by so doing, we're going to help support the duodenum and help prevent duodenal ulcers. Gastrofix is going to support the production of the stomach's own protective mucus barrier that prevents ulceration due to that acidic damage. We've also got some ingredients in Gastrofix, such as fenugreek seed and anise. These are two botanicals or herbs, whatever term you want to use, that have been utilized in human nutrition. And if I can say from an herbal standpoint, human medicine, and also in animal nutrition for almost over 100 years. I mean, it's been used since the 1800s because we know that these two herbs, they're referred to as digestives, which means they stimulate saliva. They stimulate the secretions of saliva. And this is the horse's own buffering system. One of the problems with a horse going without something to eat or something to chew on is a horse does not produce saliva unless he's chewing on something. Unlike people, we can think of something good to eat, the Pavlov dog response, and dogs can salivate without something in their mouth. We can salivate without something in our mouths, but horses don't. So when horses don't eat anything, they don't produce their own saliva, so their stomachs don't get buffered without that saliva being swallowed and entering the stomach. So some of these herbals that we have in Gastrofix will help stimulate that saliva production. So we're going to take advantage of that and let the horse's own buffering system help buffer his stomach. And Gastrofix is the only supplement on the market currently that's going to combine all of these features into one product. So how else does Gastrofix help your horse? Well, as I mentioned at the beginning, Gastrofix is also going to lend support to the hind gut health as well as gastric health. Oftentimes, gastric ulcers and intestinal inflammation are going to occur at the same time. So often we see somebody that's, we're treating gastric ulcers, but the horse really isn't improving, or he improves a little bit, but he doesn't maintain. So we say that's an indication that you've got hind gut issues. Likewise, we can have a horse that's presenting with some off behavior. We suspect hind gut inflammation. So we treat hind gut inflammation, but the horse only improves to a certain point. That can be an indication that we also have some gastric or duodenal ulcer involvement. The two often are going to work together. So this is another reason why Dr. Nichols and I specifically tried to put together a product that's going to give us all of those features and benefits that we talked about for the stomach and the duodenum, and also support somewhat the hindgut. But keep in mind, the emphasis is on foregut health. Okay, so we support hindgut health. We have prebiotics for microbiome support. We have butyric acid, which is a major tool that we use against leaky gut. We also use some functional amino acids such as L-glutamine, acetyl L-carnitine, which play important roles in intestinal epithelial cell support. So Gastrofix, while it helps support hindgut, if you have a horse that does in fact have a hindgut issue, Stride Animal Health also has the hindgut health program, has the immune health program, it has GI Calm for leaky gut in particular. All of those can be used in combination with Gastrofix, depending upon how your horse specifically presents. When should you use Gastrofix? It's almost easier to say, when don't you need it, which is not very often, especially if you're dealing with athletic horses. But we can use Gastrofix on a maintenance level. We can use it as advanced support level for active horses, or instead of saying treatment level, I would say can be used in combination with your veterinarian's medical protocol if your horse is actively being treated for gastric ulcers. And by using it in combination with your vet's protocol, you can make that protocol more efficacious and also help reduce the chances of those ulcers returning. We can use Gastrofix anytime a horse is exposed to elevated stress levels. Hopefully, you know your horse, you know when your horse's stress level is going to be tweaked a little bit. So any horse that has a history of being susceptible to gastric ulcers or intestinal inflammation is going to benefit from Gastrofix. We can also help horses that tend to get nervous or present with digestive upsets when traveling or showing, or when their exercise schedule becomes more intense. An example would be the show horse that almost every time they go to a show, they get there and they go off feed or they get snarky, which is an indication that their stomach's bothering them a little bit. So we can use Gastrofix before we ever leave home, or we can actually use it when we get to the show. Those gastric buffers that we have in Gastrofix will become effective within a very short period of time. As a matter of fact, within hours. And also, when your horse won't eat anything else, this is another beauty of Gastrofix. You can offer it to your horse all by itself, and most of these horses are going to consume enough Gastrofix to help their stomach, get them back on feed, and so they're going to have the energy and the stamina at the show to perform up to your expectations. So how do you use it? As mentioned, you can feed it alone, or you can mix it in with your horse's normal daily ration. If a horse does not have gastric ulcers or doesn't have any digestive issues, but you know that he's somewhat susceptible, so you simply want to use it as a preventative, a half a pound to 1 pound a day is all it's going to take to help prevent those from reoccurring. If you have a horse that's going to need advanced support, either because you know his training and showing transportation schedule is such that it's going to add a lot of stress to your horse, you know your horse is a little bit of the nervous type, hyperreactive type, then we can feed 1 to 2 pounds per day. Or, you know, as I mentioned, one of those horses that gets to the show and he decides, okay, I'm nervous enough now that I don't want to eat, again, 1 to 2 pounds per day. If we have a horse that we know is highly susceptible, in other words, you've treated this horse a couple of times already for gastric ulcers, so you know he's highly susceptible. You suspect he might actually have had some duodenal ulcers. unfortunately, even though your vet may not have been able to positively diagnose it that way, then we can feed 2 to 4 pounds per day. Or horses that are actively being treated for gastric ulcers by your attending a veterinarian, then you would feed 2 to 4 pounds per day in combination with that medical protocol. So in summary, Gastrofix helps prevent all 3 types of gastric ulcers. That's no small feat. Gastrofix supports liver function as well as gastric and intestinal function. It's one of the only products I know that's going to address gastric ulcers and liver function concurrently. And it's so important that those two work together, as hopefully I was able to explain. Gastrofix uses multiple buffers to stabilize the gastric pH, including stimulating your horse's own buffering system. In other words, stimulating his saliva production. Now, he's not going to get the slobbers, okay? It's nothing like that. We're simply triggering or simply stimulating his own saliva production, and it doesn't take a lot of saliva to help buffer that stomach, especially when it's empty. And last but not least, Gastrofix is going to support both gastric and hind gut health. But again, remember, the emphasis is on gastric or foregut health. So with that, I thank you very much, and I'd like to open it up for any questions.
Dr. Bill, thank you so much. I think there's a couple things that I want to underscore after, going through that presentation. And, the first is that this product was obviously developed by PhD equine nutritionists. I mean, the two of us live and breathe equine nutrition every single day. And, I think
That's true.
we have always had the same goal in mind with every product that we develop, and that's to strive. I mean, we strive to create unique solutions that are very effective. And we've shared stories back and forth about just never wanting to develop a me too supplement, if you will. So I guess I say all of that just to then tee up my second point. I mean, this is not just another gastric buffer supplement on the market. Okay.
Not at all.
I want to make sure that everyone understands. I mean, Gastrofix has very advanced functional technologies that provide a fully comprehensive support program for that horse's foregut. So,
Yes, it does. That's a great point, Dr. Nichols. And I couldn't, emphasize it any more than you just did. And I think that's important for people to understand that we develop products to help horses, not just to sell a supplement. We're not interested in that. So.
Absolutely. I think there are just a couple questions that I know are probably lingering on people's minds that I think would be good just for us to kind of stick a bow on, if you will. I know you hit them just a little bit as we went along, but are you aware of any negative long-term effects that can happen if you were to feed something like Gastrofix or a buffer like this on a daily basis?
That's actually a good question. It's a great question, actually, and probably could have gone into that a little bit deeper during the presentation. So I'm glad the question was asked. We need to distinguish between the action of stopping acid production, which is what omeprazole does, versus a buffer. And I know that a lot of people listening in, when you say, okay, we're going to talk chemistry now, and people are going to go, whoop, I'm out of here. But you don't have to be, because it is a chemical discussion. And what I mean by that is by stopping acid production, you reduce the ability of the acid in the stomach to begin to break down the food that the horse eats. And the reason you do is because the acid's not there. You stopped it. You prevented the production of it. So that's what omeprazole does. And we know that there are potential long-term negative effects of doing that, because you simply cannot break down and digest the food because your body is no longer producing the acid that's required to do that. But also, it's why Gastrogard or omeprazole is probably the most effective protocol to allow gastric ulcers to heal, because by stopping the acid, you're stopping the insult. And when you stop the insult, that gives those stomach tissues a chance to, to regenerate and to heal and then begin to function normally again. That's not what a buffer does. All a buffer does is prevents the pH, or prevents the acid that is there, from dropping the pH of the stomach to a dangerous level. I mentioned Dr. Frank Andrews during my presentation, who I consider, as I also mentioned, one of the gurus of equine gastric syndrome. He's done a lot of research on the pH in the horse's stomach and how that affects ulceration. And we know that the stomach is quite acidic, but if we have the pH in the horse's stomach dropping down around 1.1, 1.2, we're now in gastric ulcer range when the pH gets to be that acidic. That'll eat away almost anything, when you have something that acidic. We would like the pH in the horse's stomach to be a little bit higher than that, 3 to 4, for example. Now, a pH of 3 or a pH of 4, and again, for those that may not be chemically oriented, a pH of 7 is neutral, okay? So a pH of 1 is extremely acidic. You would not want to handle anything that had a pH 1 with your bare hands. Let's put it that way. But you can also see where a pH of 3 or a pH of 4 is going to be also going to be extremely acidic. So what a buffer does is it prevents, or not extremely acidic, it's still going to be acidic enough to break down food and allow it to be digested, but it's not going to allow the pH to get so low that it's going to damage the stomach lining. That is the whole idea of providing buffers. Now, long-term buffering does not continue to raise the pH. In other words, if you continually offer or feed buffers long-term, the pH in your stomach's not going to go from 3 to 4 to 5 to 6 to 7. It's going to remain within that acidic range, say 3 to 4, but it's not going to drop to that 1 level so much. Even, it can still drop low at any particular time. The pH in the stomach is not static. It's constantly fluctuating, going up and down. We're trying to prevent the pH from dropping to that very low range and staying there for any length of time. That's what buffers do. Your body itself has a buffering system. The saliva, the pancreatic buffers, which are, by the way, are bicarbonate buffers, which come out of the pancreas. So it has its own bicarbonate buffering system. The bile salts that come from the liver, these are all natural buffers. Any buffers that we put into a product such as Gastrofix are going to work concurrently and help out the horse's natural buffering system. It's a natural way of controlling pH. So there's no negative long-term effects of offering buffers on a regular basis. That's the difference between using a buffering system and using drugs such as omeprazole. It also explains why, if you have active gastric ulcers, most of the time, simply providing buffers is not going to be enough to let those ulcers heal. That's why we always say, if you've got active ulcers, you should use a medical protocol in coordination with your veterinarian, which is usually going to include omeprazole, which turns off that acid and gives those tissues a chance to heal. But by turning off that acid, what have you done to the pH now? Since there's no acid there, now your pH is actually going to rise up quite a bit. That is why there's a difference between the proton pump inhibitors like omeprazole. They can have long-term effects, negative effects, whereas simply applying a buffer and stimulating the horse's natural buffering mechanisms will not have any long-term effects. I got a little windy there, but you can see it's kind of a complicated situation, but I hope I was able to explain it.
Yeah, no, that's perfect. I mean, it is a complex situation, and it's, you kind of have to think through what's really going on in the stomach and what we're trying to do there with the Gastrofix. So I appreciate that lengthy explanation.
Exactly. Yep.
One other thing that I think is important that we hit on is just making sure that people understand that Gastrofix is a show safe product. There's nothing in here that's going to test or get you in trouble in any kind of a showing discipline. And that
is correct.
And that goes to, even, you talked about sodium bicarbonate, and I know, in the racehorse world, there's the fear of, milkshaking and testing from that regard. And I just want to put everyone at ease that there's not, you're not going to get any kind of negative or positive test, if you will, by using this.
That's correct. You are the amount of sodium bicarbonate in this product is not even remotely close to anything that's going to be a problem.
Perfect. Well, Dr. Bill, I really just want to thank you for joining me today. I mean, and not only for this educational session, but, even more for the opportunity to combine brain power and combine efforts to develop this product.
Yep. And that's why I get excited of working with you, Dr. Nichols, because I think the Gastrofix is a perfect example of what can happen when two PhDs get together and they've got similar goals and values. The bottom line is we are here to help horses, and that's what makes us, that's what makes our day. When we hear that somebody has used our product, and I've actually had people say, "You saved my horse's life," and that's what keeps us going. And so anything that we can, for you all listening in, if there's anything we can do, to help you all out with your horse or your horses, please get in touch with us, and we will certainly give it a sincere effort to do the best we can to help you out.
Absolutely. I cannot wait for people to get their hands on this product and start seeing those improvements in their horse. So if anyone is interested in incorporating Gastrofix into your program, just visit the strideanimalhealth.com website and you can find more information there. So thanks again, Dr. Bill.
Thank you.